Dope, weed, Mary Jane, or miracle drug? What should we call it? Is there a case for medical marijuana? Tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. Many of our modern medicines have their roots in plants and traditional remedies, but none attract the attention and concern that medical marijuana does. It's wrapped up in politics and social policies that are both pro and con. We'll be exploring for some truths tonight. First, let's take a look at this week's Prairie Doc quiz question. True or false? The body produces its own cannabinoid chemicals, which play a role in regulating pleasure, memory, and thinking. True or false? Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays originally written for this show comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in, but we will answer your questions about medical marijuana all through the show as they're called in. So call them in early so you can get on that list of questions that are coming in. Call your questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight are Dr. Michelle Bach, Sanford Children's Specialty Clinic, Sioux Falls, and Dr. Daniel Heineman, Chief Medical Officer, Sanford Health Network, Sioux Falls. So it's great to have you on this topic. And of course, it's a little bit controversial. I mean, a lot controversial. Mm-hmm. And you're putting yourself out on the line, and I am too. But I think what we're going to be searching for is the truth. And I know there's a lot of baggage, emotional baggage. We all have preconceived ideas about these things. So this is a call for the audience to dump your preconceived ideas and listen to these experts. But so why are you an expert, Michelle? You're a neonatologist.
Yeah, that doesn't seem like a likely expert for medical marijuana, but I'm actually a pharmacist, and I also do research on environmental exposures and the developmental origin of disease. And I also was on a year-long task force put together by the South Dakota State Medical Association.
Go SDSMA.
Yes, which actually looked into medical marijuana, and we had many experts come and talk to us over the course of the year, and we put together a nice white paper with all of the educational information regarding medical marijuana.
Did you put that white paper together? I mean, is that your doing, or the group?
The group. Yep, it was a group project.
All right, so that makes you a person who's really studied the topic.
I have studied the topic.
And Dan, you're an executive, a medical executive. I mean, a family physician at your core. Mm-hmm. But you're a medical executive. So how did you get involved with this?
Well, part of my work is working with hospitals and clinics to make sure that in the footprint that we have at Sanford, we have the state of Minnesota, the state of Iowa, South Dakota, and North Dakota. Minnesota and Iowa in the last years have passed some medical cannabis laws that now our clinicians need to understand what their responsibility is, as well as how does this affect our hospital practices. North Dakota is probably within 45 days going to have medical cannabis as well. And
Sanford has a big thing in North Dakota.
So, and I love policy and understanding that. I also do a lot of work with legislative affairs. So it was a natural for me to understand and get involved with some of those concepts and how we can help our clinicians understand what they can and should not do around this topic.
We should and should not do. The yeses and the minuses, the pluses and the minuses. Well, let's start. I'm going to start with a question, but we need your questions. So we're depending on you to call. But let's start. I mean, this is an old drug. Like 3,000 plus years ago, it was talked about in China. It's been around for a long time, and yet I keep hearing this complaint. We don't know enough about it. Scientifically, we're not sure that it does this or that. How come we don't know the scientific data about marijuana? I mean, what's happened that has kept us from knowing?
So there actually is a lot of increasing research on the endocannabinoid system, which is a natural receptor process in the brain and all over the body. And so more and more is being known about that and how it functions. But unfortunately, because marijuana is a Class 1 scheduled drug, that allows us not to be able to dispense it or utilize it or to do much research on it due to the federal requirements.
I mean,
I think it's important to understand what those classes are. Okay, we have Class 1 drugs, LSD, methamphetamine, spice, all the really
Heroin.
bad heroin, all the really
And
bad
then
actors.
marijuana is on
Right.
that.
They're drugs that have no known medical benefit to them. Now, in the 50s, or when they first came up with the classification system, they weren't sure where to put marijuana. So marijuana got put in Class 1. Then you have Class 2, Class 3, Class 4. They're all what are called controlled substances. They're controlled by the Drug Enforcement Agency, the DEA, which does this classification for us. So it has had a hard time for researchers because you need special permission to be able to do research on these Class 1 drugs.
I heard that it was Nixon that pushed it into Class 1 because he wanted to have a reason to follow the hippies because they were giving him trouble, and that was part of the political thing. I don't know if there's any truth to that.
I don't know.
Do you know anything about
I
that?
can't
You can't remember that?
I can remember Nixon. Yes. In fact, August of '74 is when he. But I can't remember when the Drug Enforcement Agency and that
I think
classification.
70s.
It was in the early '70s.
Yeah,
So
so it was Nixon.
Yeah.
It was Nixon who did it. I think there was some valid.
There's actually been a call by physician groups and organizations to reschedule that from a Class 1 to a Class 2 so that more research can be done on that.
I think that's an important thing.
It is important.
That would be a very good first step.
yeah, the AMA and its House of Delegates has had resolutions to calling upon the government to change the classifications so that we can get some more research done. You know, you mentioned it's a really old plant. Well, 3,000 years ago, medical care was basically plant-derived.
Herbal.
And I think the issue is now we have more complex understanding of complex diseases. I mean, some of the things that we know that maybe we have a belief that maybe this drug will work on, we're just having a better understanding about.
Yeah.
And so I think medicine has changed and medical treatments are changing, and I don't know that we completely understand it all.
No, we don't. I wish we had everything understand. I think the smarter you get, the more you realize you don't know.
No.
You talked about the cannabinoid system, Michelle. Can you explain that a little bit more?
Sure, our body actually has receptors that respond to cannabinoids, and so there's 3 classes. There's endocannabinoids, which are the
Endo, from inside.
from inside. So those are chemicals that are naturally made by our body that turn on or turn off these receptors, and they're actually natural products, and they're broken down by a little enzyme, and then they go away.
So they're part of our brain.
They're part of
we
our
have
brain.
a whole system that's called
And they're part
endo.
of our heart and our liver and our muscles. They're a part of every part of our body, actually.
Okay.
So they're
So that's
everywhere.
endocannabinoid.
That's the endocannabinoid system.
Then there's exo.
Then there's the phytocannabinoids, which
Phyto.
are derived from plants.
Okay, so
And
phyto
then
meaning plant.
Phyto means plants, and so those would be marijuana, which are like the cannabinoids. They actually turn on or off the endocannabinoid system,
Okay.
but they also are not able to be broken down by the normal enzymes in our body, so they can accumulate. So that makes them different. And they have multiple different, cannabinoids that
Okay.
turn on the receptors. And then there's synthetic cannabinoids, which are drugs, and that can be legal or illegal drugs that are made to be very concentrated to work on those same receptors.
But it seems to me a synthetic might be the answer eventually
Mm-hmm.
because, aspirin used to be willow root, and then we defined that this is what's the active ingredient that makes people feel better,
Right.
which eventually is ibuprofen and naproxen, that kind of group. But we developed that understanding, and the artificial aspirin is what we use now, made purely, got exactly that amount. It's easier to measure how much you get.
They have derived 70 different cannabinoids from marijuana. So
70 different
70
cannabinoids.
different chemicals that work on our own receptors.
From one plant.
From one plant.
So, but there are main two major components that people talk about. Can you explain? Let's have Dan explain the two.
Well, I'm going to defer to the scientists when we get to the technical things, but it's THC, tetrahydrocannabinoid, and then cannabinoid itself. Cannabidiol are the two most
CBD.
They're the
We talk
two
about the
most
two different-
active ingredients. And if you look at a lot of states where they're using medical cannabis, and they're primarily looking for the THC and the CBD because of their properties. THC is used a lot in treating nausea and a variety of other things. CBD is used more to treat seizures or muscle spasms,
chronic pain.
those types of.
And CBD doesn't make you quite as high.
Right. The THC is the one that's got the more euphoria.
Okay. Would you explain it any different or add anything more to those?
There's two different receptors. There's actually 7, but the two main receptors are the CB1 and CB2, and CB1 is the THC effect. It's highly concentrated in the brain, and so it causes the psychoactive effects.
And the CBD is the 2.
And CBD works on 2,
What
and
about
they
the-
antagonize each other.
Yeah.
So
So
what about-
one keeps the other in check.
Huh. What about the other 5?
So they're all G protein coupled receptors, if anyone cares.
G protein receptor, couple of receptors?
Right, and they are also, each different cannabinoid works on different
Okay.
receptors.
All right. Well,
And that's part of the challenge of using this as a, quote, medication, not knowing exactly what chemical you may have that's in the plant, what those percentages are, and how they may affect an individual. And so it is complicated and complex and confusing, which then relates to the medical clinician who says, if it's complex, confusing, and I can't understand it, we better study it a little bit more to understand where we need to be with this.
Or derive each individual
Yeah.
one. And there are drugs that are derived from these that are already on the market.
all right. We will get into this
Yep.
more. We need your questions. South Dakota is between Minnesota and Colorado, where the laws about marijuana are different. These differences bring the need to think about our actions if we travel to one of those states and return.
In South Dakota, it is still currently illegal to ingest, possess, consume, distribute, regardless of if you are doing it for recreational purposes, if you're doing it for medicinal purposes. At this point, the law is uniform in South Dakota for everyone in that no one can legally consume marijuana. So it's common for us to cite or charge people for not only possessing it, having a bag or some form of it in their possession, but also for ingesting, for consuming it, even if they came from out of state and they come to South Dakota. If it's still in their system when they're in South Dakota, it's still illegal here. I think it always creates difficulty and challenges when you have laws that can be so different from state to state regarding one substance, or laws that had at one time been uniform and have now deviated from that. I can tell you that law enforcement and prosecutors in South Dakota will continue to uphold the laws of South Dakota, whatever those may be, whatever the legislators of South Dakota determine those laws should be, including any changes that would be made. We will follow the laws as written. I'm sure if a change is made regarding medical marijuana, it would no doubt go to the courts at some point and be challenged in the South Dakota Supreme Court, if not higher courts. And we will wait to see what that outcome would be. But essentially, we follow the laws as written. So if there's a change that's determined, we would follow that. And then if the courts make a decision on the interpretation of any changed law, we would follow the outcome of that. I do think it becomes a challenge and a frustration, not only to law enforcement and prosecutors, but also to citizens when you have such deviations with laws from state to state. We have many individuals that are in one state and something is not illegal, such as the use of marijuana, and then they come within South Dakota and it is illegal here. So ideally, in the realm of the law, it's always easier for all involved if you have some uniformity, however that might come about. We've certainly seen an increase since Colorado legalized. We have a lot of individuals that tend to go back and forth between South Dakota and Colorado. I would say with Minnesota, that's still fairly new, so we haven't seen, at least down in Brookings, we haven't seen that influx yet, but I'm sure it will come. And essentially, we just take them case by case, and if they have violated the laws of South Dakota, an individual would be treated accordingly, regardless of what the law in another state might be. At this point, our role is to uphold the South Dakota laws as they are written, and that's what I know law enforcement and state's attorneys in South Dakota will continue to do.
Remember, this is your show. Your questions are key to our show discussion. Call in your questions about medical marijuana to 1-888-376-6225 or send us an email to ask@prairiedoc.org. So that was interesting. I mean, the laws are different in every state, and I think what Abby's point was that in one state it's this, in another it's that, we're caught in between. And then you can get into big time trouble in this state, for example.
Well, you know, we work in Sioux Falls. Sioux Falls is 12 miles from Iowa, 12 miles from Minnesota. And the laws are different in those two states. And so somebody coming to Sioux Falls for their medical care and they've been taking medical cannabis, now they bring it to the hospital and want, well, why can't I? Well, it's illegal in South Dakota. And oh, by the way, please go down and lock that in your trunk. Take it home. When you go home, don't bring it back so that you wouldn't get into trouble, like she said, in South Dakota with what would be considered okay in your home state, but not okay here. And that's very confusing for patients. They just don't understand that.
And that's an important point that we needed to make. And we appreciated our state's attorney in Brookings being willing to bring that up to us. Thank you. So, so there's a lot about the difference between the two kinds that we just talked about, CBD, which is primarily the one that these medical marijuana places are recommending that we provide, and the THC. Now, Marinol, which has been around for a long time, primarily used for nausea, is what, half THC, half CBD?
It's total all THC.
Okay.
100% THC.
Now, there's others that have different mixtures right now on the market that aren't oils made in Minnesota or anywhere else. What are those?
So
Sativex, right? Yeah, it is more used for muscular diseases, so it's going to be a little higher in the CBD. But those are pretty much it.
And then Epidiolex is a new FDA approved, just recently FDA approved drug, and it's an orphan drug for seizures for children who have severe seizure disorders. That's straight CBD.
Now, the law, I read in the Argus Leader this last week that the law and that the state of South Dakota is pushing, looks to be going through. I mean, it passed the Senate, didn't pass the House yet. It's coming up for the vote in the House. It passed the Senate, but there was an addition that was added that said, but you've got to make sure that it's only the FDA accredited Epidiolex version, because that way we know for sure that it is exactly up to snuff. Otherwise, you would be accepting different versions of different kinds. What's your take on that?
The original bill was to allow, they were going to do a couple of things. They were going to change the scheduling for this CBD from a scheduled, because not only are there federal schedules, but South Dakota also has scheduled drugs. We generally follow the federal scheduling. So there was a piece of legislation that was going to change the scheduling on CBD oil, this drug,
from
Schedule 1 to Schedule 2, which would then allow it to be prescribed or to be used. And they were anticipating the approval of this drug and that they would have to change the schedule for it.
Right.
In the process of the legislative process, an amendment was placed on the bill that required it to be an FDA-approved CBD product.
Right, and there's only
Essentially, right, essentially meant that there were you can't go and mail order them into South Dakota and be able to use
from a
them.
little grandma's shop in Colorado.
Or wherever. And so it
So
will
that-
be interesting to see if it ends up remaining that way as it
Right.
gets through the rest of the legislative process.
You know, that's, you know, the problem I have with supplements is that you don't know what you have. You know, you don't know the concentration, you don't know the safety, you don't know the effectiveness, you don't know whether it's contaminated or not. And so I've pushed against, you know, going to the supplement versions of things because of that. But on this hand, if we require FDA, and so that it has to have exactly this amount, it has to have all this, I know it's going to go the way of Marinol, which is $3,000 for a 1-month supply of fairly weak marijuana in an oil that is refined. I mean, you know, look what our pharmaceutical industry has done. So it's going to mean it's going to cost a lot of money.
But Rick, we're giving these to children, okay? So you do want to protect the patients, safety-wise, dosing-wise, pharmacokinetic-wise. You know, it's regulated. So, I mean, these are things that can actually affect and cause brain atrophy. And in the developing brain, some of the cannabinoids can cause brain atrophy. So you don't want to take chances of giving the wrong compound. In my mind, I think that it allows patients who have very severe neurodevelopmental disorder that causes intractable seizures where nothing else has worked, it allows them to receive treatment, even though it's scheduled 1, but in a safe manner.
Yeah,
It may be more expensive,
It's
but
the conundrum that we
It's
are.
the conundrum,
It's the
isn't it?
conundrum we're in medicine. You know, most of these initiatives have been citizen-driven and citizen-led. Even the regulated process in Minnesota really started out as a citizen-led and initiated effort to drive the legalization of medical cannabis in Minnesota. Iowa, almost the same.
And North Dakota as well.
North Dakota passed an initiated measure in the last general election. Now their health department has taken that initiated measure and made a lot of changes, and it's working its way through the legislature. But it's a conundrum for medical providers. We understand the complexities of medication and medication administration and how it affects us. And then at the same time, we understand that there's a lot of cry out there from citizens that say, we want this. We want it to be available. And I think what the medical community is saying, fine, but don't call it medical cannabis, because I mean that it denotes that something is safe.
I have to, and I'm got to be the gatekeeper.
Yeah.
I don't want to be the gatekeeper.
well, you can't be because it's illegal and you could lose your license if you prescribe or dispense it.
Yeah.
So putting physicians as the gatekeeper, or even just like Dan said, saying medical marijuana, just exacerbates the notion that this is safe and it's tested and it's okay. And we're seeing a huge increase in you know, use by youth and just
For
that it's
recreational
accepted
purposes.
for recreational
Recreational
purposes
purposes.
because it's safe. It's a medicine.
Yeah.
When really, like herbal supplements, it's not a medicine. There are properties in it or pieces of it that are used for medications, but doctors can't be the gatekeeper. It's illegal for us to be the gatekeeper.
It's just a pathway to legalizing marijuana
For
for
recreation.
recreation.
So
I understand it can help, or it may help some individuals, but it's very difficult for us to be able to discern all of that.
All right, so let's just take the question of recreational thing, and we're going to get to questions, and I should talk about it, but I want to ask this. So here we have legalization of alcohol. In fact, alcohol is everywhere, and of course we know that it can be very harmful, and when it's abused, it's very abusable.
Tobacco.
Tobacco, we have that, that's legalized, that's inhaled just like what marijuana is done. And look at the narcotic abuse problem and the deaths that are occurring from narcotic. People, you know, desperate for pain relief, going with narcotics, the narcotics not doing a great job at relieving pain, and the narcotics as well, dangerous. All legal.
Right.
And yet this which might be very helpful for chronic pain, might be a nice recreational thing like alcohol. I'm not saying I'm promoting it or not. I'm just saying in the same vein. So why not make it recreational?
Then if it's recreational, don't call it a medicine when it's not a medicine. If it's growing to increase the THC content to make you feel better rather than to increase the CBD content, which treats medical conditions, then it should be a recreational product, and it should be regulated the same way that alcohol and tobacco are by ATF.
So are you saying that it should be? Or are you
I
saying?
think that's a social question and not a medical question. If you asked me it in a different light, now medical marijuana, I honestly don't think that marijuana itself is a medicine. Are there cannabinoids that are in marijuana that are useful for medications? Yes, and they're being developed by drug companies and can be prescribed by physicians safely. But to say that marijuana itself is a medicine when there's 700 components and 70 different cannabinoids in it, and to put physicians as the responsible gatekeepers, I don't think is the right thing that we need to, tell our youth in our society.
And if it is, if society, and if if the people in our state say we want recreational marijuana, we'll learn how to deal with it. But I do think there are a lot of issues. I know law enforcement shudders because there isn't a very effective, accurate way of measuring whether or not somebody's under the influence, like
Right
we have
now.
with alcohol.
Like quickly.
And I think we have to, states have shown that the percentages of traffic accidents go up when you legalize and have recreational marijuana.
Yeah.
A lot of other things. And as long
And
as we have
public
the
health concerns like
suicides.
suicide and murders. I mean, there are public health concerns that would increase with
crime
that.
increases.
Right, but one could argue the crime issue accelerated when alcohol was prohibited in the 30s, and once we can make laws, rules are out there, one can argue those issues. I think that you see in the emergency rooms in Colorado that the people who live in Colorado, they went to the emergency rooms more often for problems. Well, that's leveled off. Now the tourists coming to Colorado, that continues to climb. That's in a recent issue of the
New England Journal.
New England Journal. So, so it's a societal question, I think, too. Probably a better societal question almost than a medical marijuana question.
We also know that just like alcohol, marijuana in the hands of young people, neurodevelopment. I think, we don't know exactly what it might mean to the maturing brains of adolescents.
But not good.
It's probably not good.
We do know there's a lot more research in that area now than there used to be, but what we do know is that chronic use, because it can't be broken down by that enzyme, that the THC component actually accumulates in the brain. And so with chronic use, not, occasional use, but with anything, chronic use can be a problem. But with chronic use, then that THC accumulates and it downregulates those receptors, which are important in protecting the brain. It makes your stem cells come and regenerate and make your brain healthy when it's sick. And so we do know that by starting young at 16 and with what they call regular use, which is they define that 10 to 20 times in a month, that they can get brain atrophy and increased risk of psychiatric disorders.
Right. Well, we can talk about the problems, but that's the one that
Right.
makes me shudder is the brain effect. And so certainly chronic use I'm against, and I'm certainly against the youth. For all other and a recreational deal, I'm going to have to, it's against the law in South Dakota, so I wouldn't say anything more. We do have questions, and we appreciate your questions. We'll come back to those after this. Marijuana contains many different chemicals. Some are responsible for the high feeling some people get, and others are thought by some to have medicinal use.
So marijuana has a lot of different components in it. There's upwards of 100 different types of THC within marijuana plants. And so the THC, or the tetrahydrocannabinol, is what actually has the euphoria effect, or the psychogenic effect that causes people to get quote-unquote high and have that feeling of euphoria. whereas cannabinol has more of the medicinal effects of what people try to use for benefit in medical uses, but it does not have the euphoria effects or the psychogenic effects that THC has. So the medicinal uses for cannabis and its derivatives, originally it was really synthesized and utilized for appetite stimulation in patients with HIV and AIDS, and then also to help with nausea and vomiting associated with chemotherapy related problems in patients with cancer. Since then, it's continued to kind of be utilized, for example, for neurologic type disorders that don't respond to typical therapies. But again, there's not a lot of good hard scientific evidence related to those things. One of the other problems associated with the whole medical marijuana situation is naturally occurring marijuana has maybe upwards of 15 to 20% of the THC component, whereas some of the more genetically engineered synthetic products contain upwards of 30 to 33% of the psychogenic THC, which again, predictability of how somebody is going to respond to this is highly variable. As far as the safety aspect of medical marijuana, certainly in the state of Colorado there have been numerous reports of the safety concerns related to medical marijuana. In fact, one of the big problems that has been documented is the increased number of fatal vehicle accidents due to impairment from utilizing recreational marijuana. Some of the dangers associated with marijuana, obviously if it's smoked, then there's obviously all the smoking risks associated with, very similar to smoking tobacco. So those are all very, very concerning for long-term use. Another big safety concern is the fact that not only is there inhaled or smoked marijuana, but there are also consumable products that can be taken by mouth. From all kinds of things, from candies to baked goods and et cetera. And big concern there would be children and adolescents getting access to those types of products and having just really detrimental effects on them. So advice for patients who might be needing to have use of legalized types of obviously allowed by law in the state of South Dakota, I would advise them to see a physician who's caring for them and describe their problems. If it's related to chemotherapy, nausea and vomiting, then certainly they can see the physicians caring for them in that regard, and those things can be done through a prescription. For me as a pharmacist, first and foremost, I don't want to cause any harm to anybody, and so that is my concern related to some of those things that people are trying to push for to get legalized. Is we just don't know long-term safety and the long-term potential negative health impacts of some of these things. And as I said, we've certainly seen some things coming out of Colorado where there had been some bad things occurring related to some bad outcomes.
Well, I thought Dr. Clem kind of gave us some credibility there, didn't he? Because he really pointed out some of the most of the very same things that we have talked about. Mm-hmm. One of the thoughts that comes up is the abuse potential of many drugs, the abuse of narcotics, the abuse of alcohol. What about the abuse of marijuana or cannabinoids in general? Is it the same, maybe less, more?
Well, I think it's probably no different than those medications or those substances. I don't know that anybody can measure.
How do you measure it?
Yeah, in certain individuals, they're at risk for abusing things. I mean, alcoholism is a disease. I mean, chronic opioid use is a substance use disorder. I don't see any difference between those two drugs and cannabinoids or THC in cannabis. So,
Any comment?
Right. There is a new DSM-5 diagnosis for cannabis use disorder, and so it involves the same things that alcohol.
Yeah.
You know, if it interferes with your lifestyle and you can't quit and you have symptoms when you do try those things. And so if you apply that to people who are chronically using, then 1 in 9. But that,
I
probably
think-
similar.
And I think most people have the picture of the occasional user. But I think the real worry is more than just the occasional user. And as we've talked about, younger people using this.
There it is.
And you know, we know that brains are still developing well into our 20s. And
So that's our concern. I mean,
Yeah.
certainly as medical people, we worry about our children, you know, all our children. Let's hit questions. Could medical marijuana be used for high blood pressure?
Well, that's a good question. Actually, initially, the response of the CBD or cannabinoids is to actually lower blood pressure at first, but then chronically over time, your receptors downregulate and you can get high blood pressure. Also, your heart rate can increase a little bit with the receptor, and it increases the heart's capacity to use oxygen. So, unfortunately,
So no good answer for blood pressure.
no good answer.
And we have a lot of really good medications to treat hypertension.
Right.
So
What about for pain? I mean, let's ask that question. There is a lot of people saying that it really does help, for example, arthritic pain.
There actually is pretty good evidence to show that cannabinoids do help treat pain.
Probably better than
Acute
narcotics.
pain better than chronic.
Well, chronic pain is a bugaboo that nothing seems to help.
Right.
chronic intractable pain was added to the list of conditions in Minnesota that you can certify a patient to get access to medical cannabis. And so I do think there are individuals where it does work really very well.
I listened to an NPR show some time back when medical marijuana was the use in Colorado. It wasn't opened up like it is now, right? So you could go get a doctor to prescribe. So this reporter drove from the east coast of Colorado, and he came into a doctor's office he heard that prescribed medical marijuana, and he walked in and he said to the doctor. He's been having some back pain. And the doctor said, okay, I'm writing out this prescription for marijuana for you. And the guy says, aren't you going to examine me? And the guy says, I'm an OBGYN, for God's sake. Why would you ask me to do that? So it goes to show that it's a slippery slope on that side. We're not very good gatekeepers. And that was the report on NPR. And I have to say, I believe the reporter. It was an interesting story. Anyway, my mother had passed away due to malnutrition in the hospital and wouldn't eat. It's my understanding that one of medical marijuana's effects is to increase appetite. Is this true? If so, I do not understand why a physician would not give medical marijuana through smoking or in food to help increase her appetite.
Well, it does.
It does.
It does stimulate the appetite. And the reason the physician may have been illegal in wherever his
or her state.
his or her state. Chronic malnutrition generally is on the list of recognizable conditions that you can certify an
use of-
individual for. 'Cause remember,
Wasting
a
disease.
physician cannot prescribe this medication. It's I use the term medication loosely here, but you
I
cannot.
can prescribe Marinol, though.
Marinol is
Marinol-
actually approved for
Marinol is approved,
appetite.
right? But marijuana is still a class 1 medication. It cannot be prescribed
In South Dakota.
anywhere.
Anywhere.
Illegal in the country to prescribe it. Now, I can certify that you can get access to it if my state has said it's legal, but a physician does not prescribe it. So, in the truest sense of the word, all physicians are doing in states where it's allowed to be used is
Is certifying.
certifying that somebody has a condition that the state has allowed it to be used for.
There it
so
is.
you cannot prescribe it. So
That's an interesting turning point, isn't it?
Yep.
It just makes this
complicates it.
this whole deal of it being a class 1 drug, are the negative side effects, and I do think that the idea of chronic wasting diseases of all kinds,
AIDS.
HIV,
Yep. Again, that's one of the recognized
but
conditions.
different kinds of cancers and different kinds of wasting. But it's also helpful for people with terminal cancers and chronic pain and severe pain and nausea with all that. They're good indication for that, appropriate indication. Are the negative side effects of marijuana blown out of proportion? The negative side effects. We've kind of spent some time on that. Do you think those are blown out of proportion?
I think that it depends on what you're calling marijuana. So, the plants are now bred to increase the THC content, which is the psychoactive component, so that you get more of a euphoria or a stimulation of your brain. But that's also the one that causes toxicity. So if you're talking about the CBD, which has less of that, and then versus the THC, we used to just have 3% THC in the normal wild type plant. Now plants are bred so that they have about a 20% THC component, and then it's concentrated down further in some forms of marijuana or cannabis, medical cannabis, to be even up to 80%. So yes, there are adverse effects that are dose related. Taking physicians and people who prescribe based on doses out of the picture takes away our ability to actually monitor that and safely say that we can watch for adverse events and drug interactions.
So it's a complicated picture,
complicated.
Is it not? So the side of negative side effects, aside from that of potential brain effects, chronic brain, is Alzheimer's? I've read it in the Week news journal. Information that suggested that there was one study that thought that they're kind of tied it to Alzheimer's disease, and that people who were heavy users for long periods of time have more memory problems than Alzheimer's. Comments?
Well, as you said, it causes brain atrophy over time.
Yeah, so the receptors actually of the normal endogenous system, right, get downregulated with chronic use, which then causes, those are the cells that heal your brain.
Right.
So all those synapses, you can actually lose your synapse and you get synaptic gaps that can't be filled in or fixed in a brain that's chronically exposed to marijuana.
That makes me think about the people who are cocaine users, and then when they finally off of it, they have anhedonia. They have lack of happiness, and it takes them years if they can
Yes.
ever get any happiness back. It's better to be, why are we constantly looking for something to change our brain from sober, alert, to less?
good.
Because everything is a loss from our normal, is it not?
I do want to bring up one other
Yeah.
side effect, Rick, because I don't think a lot of older adults might recognize, but it can increase your risk of a heart attack. So if you are prone to having heart disease, that's something that you should be aware of. That
Because
it can increase.
it can be exciting. The THC can be exciting.
The
and put them in-
THC increases the oxygen consumption of the heart. So if your heart already has less oxygen to it from ischemia, you can increase your risk of a bad heart attack.
Okay.
They're seeing that in Colorado, one of the things they're finding.
Yeah. What's the suggested method of ingestion? Now, what options of ingestion are there?
Well, nothing good comes from smoking anything, but that is an option.
Right.
There are oils that you can put in e-vaporizing type devices, so you can get like an e-cigarette, if you will. In that, there's tinctures that can be absorbed under the tongue, capsules, and then edible. And we were talking earlier about it's fascinating about edibles, and you might want to.
Right, so when you smoke or vaporize it, the peak is actually within 30 minutes. So you get a quicker high. But unfortunately with edibles, the peak is at 3 hours. And so you may not feel that euphoria right
So you
away.
should have a
so you just
second
eat
brownie.
a bunch more.
Well, and you're
eat a bunch
hungrier too
more,
anyway.
Yeah.
And then 3 hours later, you're psychotic. So that's why they see that tourists go to places where
Emergence.
edibles are, pretty popular. And then unfortunately, they're trying to kind of catch up.
There's a certain amount of schizophrenia that can occur in certain people. Does it make schizophrenia, or does it just uncover schizophrenia, or what's that?
Probably uncovers it because, and it is contraindicated in people that have
Major psychiatric illness.
illnesses, but it can uncover it and then stimulate it,
Right.
make it worse.
And just like the black box warning on SSRIs, if you're prone to having depression or anxiety, it can increase your lack of judgment and increase your risk of suicide.
Right. Let's march through these questions so that we
Okay.
don't have questions after the show. And
Sure.
Is medical marijuana being used to treat Alzheimer's or PTSD?
PTSD, yes. Alzheimer's, it's
No.
not in any state jurisdiction or any programs where I've seen it being used for Alzheimer's
But
disease.
PTSD?
Depression, anxiety. Although it is interesting, it can cause anxiety too.
Right.
Yes.
So
And there actually have been some good studies looking at PTSD, and they've not found a benefit. In fact, it may be worse. But some states still have that on their certifiable list.
Okay. Why is medical marijuana considered a gateway drug, and can it be related to an individual having a predisposition to addiction? So gateway, I can guarantee you that anybody who's hooked on heroin drank milk when they were younger.
yeah, or 8 carrots and had cancer. Yeah,
8 carrots, cancer. What is the cause? Do we really know that marijuana is a gateway drug, or is it that that's who you're hanging around with, or what? Do we know?
It's probably why it's a gateway. It's you develop a habit. You are seeking something that
That might not be giving you anymore, and then there you go.
or the company you keep. Who knows?
Who knows? Good answer. We don't know, do we? In 1937, a ban on marijuana was lifted. How would it, if the 1937 ban on marijuana was lifted, how would it impact research on medical marijuana? In other words, if we could take off the Controlled Substance Act of what was it? I thought it was 1970.
I did too.
What difference? We could do better research, could we
Right.
not?
Researchers would have better access to it because right now, in order to be able to do that research, you've got to go through a lengthy federal process to get access to the drugs.
So we've got 30 seconds. Neuropathy, is medical marijuana helpful for peripheral neuropathy?
It is on the list, whether it's helpful or not.
We
but
don't know.
We don't know.
Research. My arthritic condition has me on numerous opioid medications. I was wondering if there's been a study comparing cannabinoid oil mixed with marijuana as opposed to taking hydrocodone.
So
Michelle.
again, like pain, or for chronic pain, there are some moderate research studies that show some improvement.
Okay. And now for the winner of tonight's Prairie Doc quiz question. True or false? The body produces its own cannabinoid chemicals which play a role in regulating pleasure, memory, and thinking. And the answer is?
True.
True. And it was Jack Resch from Philip, South Dakota, who answered the question correctly. Thank you, Jack, for participating, and a book will be in the mail to you soon. So any comments? We have 30 seconds to talk about that particular answer, the internal cannabinoid issues that are going on.
Just that, we do have these internal receptors, and it's part of our brain.
10 seconds.
We don't know what external cannabinoids will do to our brains.
All right. Thank you guys very much.
Thanks.
We'll
for
be
having
right
us.
back after this.
Good day, citizens. It is with regret that I inform you that the end is near for me. I'm old, I'm tired, I'm weak. But don't go thinking that you've won the war against the flu. Before I go to that big petri dish in the sky, I will find a suitable replacement. Be warned.
Just about 4,000 years ago, Chinese writings explained the medicinal powers of what is now called marijuana or cannabis, describing its power to help arthritis, gout, malaria, nausea, and psychological stress, along with its intoxicating recreational properties. The use of cannabis for medicinal and recreational purposes eventually spread to India and then Persia, often used by various religions during ceremonies. From there, during the Middle Ages, cannabis spread to Europe. In the 15 and 1600s, the Spanish English brought marijuana to the New World for medical properties, and alongside tobacco, it became a huge commercial crop for the fiber in making rope. In the late 1800s, marijuana lost popularity as a fiber for rope and as a medicine for pain. But in the 1920s, cannabis reemerged in jazz clubs as a recreational drug. At the time, it was thought of as a better alternative to alcohol since cannabis users didn't seem as disruptive to the community. In the Prohibition era of the 1930s, the U.S. Bureau of Narcotics considered marijuana as addictive, and they made it illegal along with alcohol. Further, the U.S. Controlled Substance Act of 1970 defined marijuana as a Schedule I drug, along with heroin and LSD, claiming high abuse potential and no medicinal use. Although these claims have changed, the U.S. law remains on the books. During the Obama administration, however, the Department of Justice was directed to relax prosecution of marijuana rule breakers while allowing state rules to supersede the U.S. law. Questions about cannabis remain, since scientific experimentation for medicinal use has been limited due to those legal restrictions. Are there legitimate medical uses for cannabis or any of its chemical derivatives for seizures in children, chronic pain syndrome, glaucoma, appetite stimulation in wasting diseases, and nausea and malaise in cancer patients? Is it right to restrict recreational use of marijuana when we accept alcohol use in this society? If we require cannabis only for medicinal use, are we limiting access for those who can afford a physician, making physicians gatekeepers for this drug, and making the cost of legitimate cannabis outrageously priced along with almost every other prescription medicine? Finally, we know there is abuse potential with cannabis, just like with alcohol. And driving while intoxicated with cannabis increases crashes, even if only half as much as alcohol. Also, we know excess marijuana dulls and injures especially young, undeveloped minds. Would legalizing cannabis worsen or, with subsequent enhanced regulation, lessen these problems? Legalizing marijuana is a very interesting issue worthy of an open-minded discussion. Well, a great big thank you to our guests, Dr. Michelle Bach and Dr. Dan Heineman, for their willingness to come on the program, clear away some of the smoke obscuring tonight's topic. You know, you put yourself on a little bit of a spot, and I really appreciate you willing to talk to controversy. Time for our flu update. So far this season, there's been 1,027 confirmed cases, 273 hospitalizations, and 10 deaths, 3 in the last week alone from the flu. It's widespread in South Dakota. So get your flu shot. That does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people.
Like a conveyor belt to process food, our gastrointestinal tract transforms what we eat into the elements we need to survive. Problems along the GI tract. Next time, On Call with the Prairie Doc.
Major funding for On Call and the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions: the Brookings Health System, Ophthalmology Limited, South Dakota State Medical Association, the Vera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen Asthma and Allergy, the Black Hills Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care, Sanford Clinic Community Service Committee, Regional Health, and Swift Dell Communications.